Okay, let's dive in. Thinking about social media today, I mean, it's everywhere, isn't it?
Totally. It shapes how we connect, how we get news.
And, increasingly how we deal with health stuff. But let's rewind a bit. Think back to when these platforms were like just getting started.
Yeah, the early days. What did it even look like then?
Exactly. And how were researchers trying to figure out what it all meant for something as important as, well, health communication?
Feels like ancient history now, almost. But 2007, that was a really key moment, wasn't it? The very beginning of widespread social media use.
It really was. And trying to understand it back then, a whole new ballgame.
For sure.
And that's where our source for this deep dive comes in. We're looking at a paper from 2009 published in the Journal of Medical Internet Research.
All right.
It's called Social Media Use in the United States, Implications for Health Communication. The authors are Chow, Hunt, Beckjord, Moser, and Hess.
Right. And what makes this paper so interesting is the data, isn't it? It's from the 2007 Health Information National Trends Survey.
Hints, yeah. A really important national survey that tracks how Americans find and use health information.
And that 2007 survey was kind of a big deal because it was one of the first large-scale efforts to actually ask people about using specific platforms like blogging and social networking sites.
By name, yeah. So our mission here is to really unpack what this paper found, like who is using social media in the U.S. back in 2007.
And what predicted it? What factors made someone more likely to be an early adopter?
And crucially, what did the researchers think this all meant for health communication as this, brand new landscape was opening up?
It's like looking at the internet's baby pictures, but specifically through that health lens.
Yeah, exactly. So let's set the scene. 2007. First thing, not everyone was even online yet. The paper says about 69% of U.S. adults had internet access.
Which means almost a third didn't. That's a huge gap, that digital divide. Really important context for everything else.
Definitely. Now, okay, among those people who were online, social media use, still pretty low compared to today.
How low are we talking?
The study found only about 27% of those internet users said they used at least one type of social media the survey asked about.
Wow, 27%. That feels tiny now, doesn't it?
Right. But back then, that was significant enough to make researchers sit up and take notice.
So what types of social media did they actually look at in the survey?
Okay, three main types. The most popular was visiting social networking sites, and the examples they gave were things like MySpace or Second Life. Remember those?
Oh yeah, MySpace. Blast from the past. So how many people were using those?
That was about 23% of the internet users, so the biggest chunk.
Okay, what else?
Then there was blogging, but specifically writing in an online diary or blog.
Actively creating content. Less common, I bet.
Yep, much smaller. Only about 7% of internet users were doing that.
Okay, and the third type?
The third one, and maybe the most obviously health-related, was participating in online support groups, specifically for health or medical issues.
Interesting. And that number?
Even smaller, just 5% of internet users.
So SNS was the big one, then blogging, then these health support groups, way down at 5%.
Exactly. Now, the researchers wanted to know why. What made someone likely to use these things? So they did what's called a multivariate analysis.
Okay, break that down a bit.
Basically, you throw a bunch of potential factors into the mix: age, education, income, health, where you live, all that stuff. And the analysis tries to figure out which factors are actually driving the behavior, even when you account for everything else at the same time.
So it isolates the really important predictors.
Precisely. And they found something pretty striking.
What was it?
For general blogging and using those social networking sites, the broad stuff, there was really only one factor that consistently stood out in the main analysis.
Just one. What was it? Age.
The age, okay.
Yeah. The younger you were, exponentially more likely you were to be using these platforms.
Wow. Got any numbers on that?
Oh, yeah. Get this. Compared to adults aged 65 and over, 18 to 24-year-olds were.
No.
Wait for it. 47.85 times more likely to use social networking sites. 47 times. That's massive.
Isn't it? Just a mind-blowing difference based purely on age back then.
So it really was a young person's game at that point.
Yeah.
What about blogging? Similar pattern.
Very similar, yeah. Maybe slightly less dramatic, but still huge. That same 18 to 24 group was 19.11 times more likely to be writing a blog compared to the 65-plus group.
19 times.
Yeah.
Still enormous. So overwhelmingly a youth phenomenon for SNS and blogging.
Totally. Age was just the dominant story for that first wave.
Huh.
But did that hold true for all the types they looked at?
Good question. What about the online support groups? Were they also just driven by young people?
No, that's where it gets different. Those online support groups, maybe not surprisingly, given they were explicitly about health, they were strongly linked to health factors.
Okay, that makes intuitive sense. So age wasn't the main thing there.
Age was still a factor in the analysis for support groups, but it wasn't that simple younger is higher trend. Actually, the youngest adults, 18-24, were less likely to use them compared to older folks.
Oh, interesting. Less likely.
Yeah. But then people aged 25 to 44 were more likely than the 65 plus group. So it's sort of a peak in like young to middle adulthood, not just the very youngest.
Huh. So a different age pattern entirely. What about the health factors? What predicted use?
Right. That's where it gets really clear. People who rated their general health as only fair or poor, they were 2.25 times more likely to be in these support groups compared to people with better health.
Okay, so definitely linked to poor health status.
And psychological distress was another big one. If someone reported distress, they were 3.28 times more likely to participate. Really highlights that need for coping and support.
Wow, over 3 times more likely. That's significant. What else?
Cancer experience was huge. If you had a personal diagnosis of cancer, you were 4.2 times more likely to use an online support group.
4 times, okay.
And even having a family member with cancer made you more likely, 2.11 times more likely.
So it really drew in people directly facing major health challenges or supporting someone who was. Makes perfect sense.
It does. But here's something interesting. What about having, like, a regular doctor? Did that matter?
Good question. Did access to traditional care influence whether people sought online support?
Surprisingly, no. In that big multivariate analysis, having a regular healthcare provider was not a significant predictor for using support groups.
Huh. So among people already online, having a doctor didn't make you more or less likely to join one of these groups. It was really driven by the health condition itself.
Seems like it, yeah. So, okay, support groups, health-driven, complex age pattern. What about blogging? Back to that one, you said it was almost all age.
Pretty much. Even when they drilled down and looked within specific age groups, doing what they called age-stratified analyses, nothing else really popped out as a significant predictor for writing a blog.
It's age, age, age.
It really seemed to be the story for blogging in 2007.
And just to clarify, that was specifically writing a blog, right? Not just reading them.
That's a really important point, and a limitation the paper acknowledges. They only measured active bloggers. They likely missed a whole bunch of people who were just reading or commenting.
And that audience might have looked different demographically.
Could have, yeah. We just don't know from this data.
Okay, so let's go back to the big one. Social networking sites, SNS. We know age was the giant predictor. Was there anything else significant in the main analysis?
Age was definitely number one, with those huge odds ratios for younger folks. But there was one other factor that came up as significant in that main analysis, looking at all internet users.
What was it?
African Americans were 1.51 times more likely to use social networking sites than non-Hispanic whites.
Whoa, really? That's fascinating, especially given, historical patterns of the digital divide, often showing lower adoption in minority groups initially.
Exactly. This was among people already online, remember. So within that online population, SNS use seemed to be penetrating differently.
So it challenged some assumptions back then.
It did. The authors pointed it out as kind of surprising. It suggested maybe these platforms could be a way to reach certain communities if the basic internet access hurdle could be overcome.
Interesting potential there. Did they find any other sort of quirky things when they looked within specific age groups for SNS, like they did for support groups?
Yeah, a couple of interesting little details came out in those age-stratified analyses. For the middle-aged group, 35 to 54.
Okay.
Having no personal cancer experience actually predicted higher use of social networking sites. People without a cancer history were more likely to be on SNS in that age group.
Huh. That's kind of counterintuitive. Any idea why?
Well, the paper doesn't really speculate deeply, but maybe. Maybe people without that specific health focus were using SNS more for general social connection, whereas those with cancer might have gravitated towards the support groups instead.
Pure speculation, but it makes a certain kind of sense, right? Different needs, different platforms.
Possibly. It shows how complex these interactions can be within age groups. And then for the oldest group, 55 plus.
Yeah. What predicted SNS use there?
Just one thing. Being male.
Really? Just gender?
Yep. Men aged 55 and over were almost twice as likely, 1.87 times, to be using social networking sites compared to women in that same age bracket back in 2007.
Wow. So these little details really paint a more nuanced picture than just it was all young people. Even within that big trend, other factors mattered for specific groups.
Exactly. It wasn't a totally uniform landscape, even beyond the huge age skew.
Okay, so let's pull this all together. We've got the massive age effect, especially for SNS and blogging. We have the health-driven nature of support groups. We have that surprising finding about African American use of SNS among internet users. What did the researchers say this all meant for health communication back then? What were the big takeaways for people trying to use these new tools?
Well, the most obvious one was about targeting your audience.
Mm.
If you were a health communicator in 2009 looking at this 2007 data, you had to realize that social media was, first and foremost, a channel to reach younger people.
Right. Trying to launch a big campaign aimed at seniors on MySpace probably wasn't going to fly.
Not based on this data, no. It wasn't the universal megaphone it sometimes feels like today.
Okay, what else?
They also saw potential related to health disparities. That finding about SNS use among African Americans online, it suggested these platforms might actually help reach groups that were traditionally harder to engage online.
Provided they had internet access in the first place. That big caveat again.
Always the caveat. But the idea was that among those online, social media didn't seem to mirror the same access disparities seen with the internet overall.
So maybe social media itself wasn't creating new digital health divides as much as the basic internet access divide was, at least not initially.
Yeah, it seemed to be the implication, yeah. A little glimmer of hope that if you could bridge that initial access gap, these tools might offer new pathways.
And what about the family connection? People with family members who had cancer use support groups more.
Right. That pointed to the idea of reaching beyond just the patient, using social media to connect with caregivers, family members,
Yeah.
those sort of secondary audiences who are super important in healthcare.
Makes sense. And did they touch on how things might change? Like, would people start using MySpace for health support?
Yeah, they did sort of hint at that. They wondered if the newer, more interactive platforms like SNS might start taking over some of the functions that those dedicated online support groups traditionally filled.
Seeing the lines potentially blurring between general social connection and specific health support.
Exactly. It was all moving so fast, even then.
Which brings us to the limitations, right? Looking back now, over a decade later, we have to remember what this study couldn't see.
Absolutely critical. And the authors knew it too. The biggest thing is just the timing. The data is from 2007.
Ancient history and internet years.
Pretty much. I mean, the paper even notes platforms like Twitter were just starting, mobile, social media. Barely a blip on the radar in this survey. Things were changing incredibly rapidly.
Month by month, practically.
And it relied on self-report, right?
Yeah.
Asking people to remember and report what they did online.
Mm-hmm.
There's always a chance people forget or misunderstand the question.
Sure. Standard survey limitations. Like response rates, too, though hints is generally pretty robust.
Oh, true. But maybe the most significant limitation, especially for health communication, was something you touched on earlier, for blogging and social networking sites.
Yeah.
The survey didn't ask if people were using those specific platforms for health reasons.
Ah, right. So they knew who was on MySpace or who was blogging, but not if they were actually talking about health or looking for health info or getting support there.
Exactly. That was a huge missing piece. Were people using SNS because of health content? Or was it purely social, meaning health communicators would need to figure out how to fit their messages into that context? This paper couldn't tell us that for SNS or blogging.
It's like you saw this new town square filling up with people.
Yeah.
But you didn't know if they were chatting about the weather or politics or seeking medical advice. You just knew they were there.
That's a perfect analogy. They saw the crowd gathering on these new general platforms, but the specific health conversations were still mostly happening elsewhere, or at least weren't being measured yet.
Okay, so let's wrap this deep dive up. What's the core takeaway? If you had to boil down this look back at early social media from the Hints 2007 data, what is it?
I think the main thing is this. Back in 2007, social media adoption in the U.S. was just profoundly shaped by age. It was overwhelmingly a young person's world online in that sense.
But not entirely simple.
No, because within that online population, there were these surprising signs that it was reaching across certain demographic lines, like race ethnicity for SNS, in ways that maybe differed from general internet access patterns. And of course, online support groups stood out as this distinct, clearly health-driven niche.
So, a landscape really defined by youth, but already showing hints of the much more complex role social media would eventually play.
And the paper itself was basically saying, look, this is just the start. We need to keep watching this, keep researching it.
It really makes you think, doesn't it? This paper, using 2007 data, gave us one of the first solid snapshots right as social media was taking off.
Yeah.
Now, fast forward today. These platforms are so deeply woven into everything how we connect, how we get information, including so much health information. How many of those early patterns do you think still hold true?
That's the million-dollar question, isn't it?
And what completely new dynamics are shaping things now? Things like algorithms, misinformation, influencer culture, mental health impact, stuff they couldn't have even imagined back in 2007.
It's a totally different universe. The paper called for ongoing research across disciplines, and man, you can see why that need has just exploded since then.